Hello, ladies and gentlemen. My name is Cohen-Gadol. I'm a neurosurgeon. I have been involved in the management of chordomas and more specifically surgical management of chordomas for many years. And I'd like to talk to you about the journey of the patients when they're diagnosed with chordoma in this short lecture. As a definition, chordomas are tumors that are slow growing, not necessarily cancerous, and may cause mild symptoms, and therefore they're often diagnosed at the later stages when the size is much bigger. The chance of recurrence for these tumors is unfortunately high. In other words, if we do the surgery and remove them and even treat with radiation, these tumors tend to recur, and that's because they're very sticky and adherent to the surrounding structures at the level of the skull base. These tumors can occur anywhere along the spine and at the level of the skull base, and even all the way to the level of the tailbone. They can invade surrounding structures, mainly the bone, and therefore their gross total resection can be limited. So what about their epidemiology? They are fortunately rare. They affect 1 per million people each year, and they account for just 1 to 2% of all bone cancers in the world. They are more commonly seen in older adults, typically 40 to 70 years of age. What are the symptoms? The symptoms can be non-specific and very much related to almost to any brain tumor type. Their symptoms are vision problems, double vision, headaches, vertigo, hearing loss, numbness, difficulty swallowing, facial pain. This is if the tumor is located at the level of the skull base. If they are situated at the level of the spine, it can be low back pain, numbness, changes in bowel habits, incontinence, impotence in men, and changes in mobility and the ability to walk. What are the tests that we do to diagnose chordomas? Typically, a CT scan can really evaluate the bone where these tumors are originating and assess the type of erosion or changes they're doing in the bone, and therefore making their diagnosis more clear before surgery. Importantly, we also perform a magnetic resonance imaging or an MRI before surgery to be able to understand how much the soft tissues are affected by the tumor or how much of the tumor is affecting the brain. And we may perform a biopsy to establish the diagnosis and assess the growth rate of the tumor before a surgical intervention is undertaken. There are typically 3 or 4 modalities for treatment, including surgery, radiation, chemotherapy. But again, most likely there are a combination of these therapies involved for the management of chordomas to be effective. Surgery is the primary mode of treatment. It's most effective. The goal is to remove as much of the tumor as possible. The surgeon operates through the nose or through what we call a transsphenoidal operation in a minimally invasive fashion to be able to maximize the tumor. This is a very highly technical operation. It should be performed by the surgeons who have significant experience in removal of this tumor. In addition, and rarely, the surgeon may use a more invasive procedure called a craniotomy, where a piece of skull is removed temporarily to remove the tumor and then replaced after the tumor section is complete. The second mode of therapy is external beam radiation or proton beam, where high energy radiation is applied to the tumor bed after surgery, and this usually takes about 5 times a week of visit for several weeks. And also radiosurgery, which involves concentrated beams of radiation are aimed at the tumor. So overall, the first 2 treatments that I mentioned are critical. However, chemotherapy is rarely used for the treatment of chordomas. This modality may be used only in advanced cases where the tumor has spread, and the chemotherapy treatment typically targets rapidly dividing tumors or those tumors that are more malignant. So what are the complications related to surgery? Could be brain fluid leak through the nose, loss of bowel or bladder function if the tumor is in the spine. Sexual function could be affected, numbness, movement problems, double vision, loss of pituitary function, or other complications, including loss of vision or partial vision, can be problematic. But again, these complications are rare. Overall, chordomas are slow-growing tumors, but unfortunately they have a high risk of recurrence because of their adherence to very critical structures at the level of skull base. The median survival is estimated about 6 to 7 years after the diagnosis. It is very important to seek care from oncologists and skull base surgeons, including neurosurgeons and head and neck surgeons who have significant expertise in the management of this tumor type. Again, I think these are critical features for you to know if you've been diagnosed with a chordoma, and I'll be more than happy to provide a second opinion or consultation and be able to help you in any way possible. Thank you.